Today we are going to discuss the safety and necessity of blood transfusions in the inpatient setting as a bedside nurse. After this lecture, students will be able to identify symptoms and lab work necessitating a blood transfusion for their patients. Students will also understand the steps for safe administration and monitoring of the patient during a blood transfusion. Students should also be able to recognize signs of adverse reactions during a blood transfusion. When and why would a patient receive a blood transfusion? Patients may be experiencing moderate anemia to severe anemia. They may also have coagulation disorders such as hemophilia, von Willebrand disease, liver disease, vitamin K deficiency, or disseminated intravascular coagulation, also known as DIC. Your patient may also have massive blood volume loss via trauma, childbirth, surgeries, or gastric bleeds. What are the steps for safe blood administration? First, you should identify your patient's most recent type and cross match. At most facilities, this is valid for 72 hours. You should obtain informed consent from your patient or their guardian, confirm if they've had a transfusion in the past, and if so, if they've had a reaction, and identify any allergies. You should ensure the provider order is present in the patient's chart. You should then have large bore IV access with a patent vein and preferably a second site of IV access in the case of a transfusion reaction. You may then assemble your supplies. You'll need Y tubing with a blood filter and 9% normal saline solution. Next, you should obtain baseline vitals directly prior to the initiation of your transfusion. You should obtain another set of vitals 15 minutes into your transfusion and then within 30 minutes of completion of your blood transfusion. Once the blood is received, only one unit may be given at a time, and each unit must be administered within 4 hours of collection from the blood bank. What are your signs and symptoms of a transfusion reaction? Within minutes of initiation of your transfusion, 2 hours, your patient may experience fever, chills, urticaria, nausea, vomiting, pain at the IV insertion site, hypotension, or shortness of breath. You may also have a delayed transfusion reaction, and this can occur hours to days post-transfusion, and it can include fever, rash, swelling, transfusion-associated acute lung injury, or transfusion-related circulatory overload. Severe reactions may occur during the time of infusion or have a delayed reaction. These can include acute kidney injury and or renal failure, anaphylaxis, or disseminated intravascular coagulation. What should you do if you suspect your patient is experiencing a transfusion reaction? First, you should stop the transfusion immediately. Stay with your patient. Notify the patient's provider of the situation. Obtain vital signs. Maintain your IV access with normal saline. Treat the patient and their symptoms. This could include administering diphenhydramine, Tylenol, etc. You should then return the blood and the tubing to the blood bank for testing.